Okay, here is the glomerulus, and let's just look at some stuff first. Here's the capsule out here. It's called the glomerular capsule, a simple squamous epithelium. And this capillary bed is called the glomerulus. Glomer means ball, so it's a capillary ball. Now, let's look at the blood flow. Here's the afferent arteriole, which is bringing blood into this capillary bed called the glomerulus. And here's the efferent arteriole leaving. The afferent arteriole is larger in diameter than the efferent, and so it builds up pressure in this little capillary bed here. And it will leak into the capsular space, the space between the glomerulus and the capsular space. What leaks out of here is called filtrate, and that'll become urine later. Now, this outside covering out here, the glomerular capsule being simple squamous epithelium, is going to invaginate and cover the capillary bed. Well, half of this glomerulus is covered and the other half is not. So you can see all the little fenestra in the capillaries here. That's the only reason this side is not covered. But this side, here's the nucleus, these little silver nucleuses of the cells called podocytes. So the simple squamous epithelial cells that make the capsule, when they come in and cover the glomerulus, they differentiate or change into another type of a cell called a podocyte. And you can see that it has little extensions coming off of them. These are called pedicels. It means little feet. So these little extensions are pedicels. And they interlock here. These are called filtration slits. Now, when the filtrate is formed in here, when the capillary leaks and forms filtrate, it's going to leave by this vessel here, which is called the proximal convoluted tubule. Now, in this model, we have also the distal convoluted tubule. Now, what you can see is there's a whole lot of cells that make up this distal convoluted tubule, but there's very few that make up the proximal. When you tilt it up this way, you can see that there's not very many nuclei. You see one here, there would be one over here, one there, and one there. So you have very few that make up the proximal convoluted tubule and a whole lot that make up the distal. The proximal has a whole lot of microvilli for absorption of the filtrate, the materials out of the filtrate. The distal has a whole lot of cells with fewer microvilli for absorption.